So people see on television or in the magazines these ads, we call them direct-to-consumer ads, DTC ads, and it seems to suggest that if you're depressed, you take this particular antidepressant and bingo bango, you're going to feel just fine. You're going to get well. Well, it's not quite that simple, and let me explain why. The first problem is finding the right antidepressant for you. So when we in our office do research on new antidepressant agents, we're part of a study that may study hundreds or thousands of patients. And so the result of that study tells us that with this particular compound, say 50% of patients got well. 2/3 of patients got better. So we know the percentages. The problem is that patients, people like you, are not groups of people. And so we don't know when we treat you as a patient with an antidepressant whether this is the right drug for you. We do the best we can. We base our decisions on a variety of factors, side effects, what's most likely to help the symptoms you're presenting with, family history of success with drugs, and so forth. So we make informed decisions. But unlike antibiotics where we have a test, so if you have a sore throat, we swab your throat, we culture it on a petri dish, we find out what bacteria grow, we put little discs with all the various antidepressants on that disc, and we see which one kills the bacteria growing in your throat the best. And unless you're allergic to that drug, that's probably the drug we're going to use. We have an indicator of what's likely to be best for you. We don't have that indicator with antidepressant drugs. So we select based on a variety of factors, but we don't know exactly which drug will work for which patient. So we may have to try not one, but maybe 2 or 3 different drugs across time to find out which one works best. So problem number 1 is finding which drug works best for which patient. The second problem with the DTC ads is they seem to indicate these drugs are going to work pretty quick. Actually, in a 60-second ad, patients are already getting better. Well, the reality is life is not like a 60-second DTC ad, that it takes weeks or sometimes months, up to 3 months, for patients to max out in terms of the effect, the beneficial effect of the medications. And finally, in the DTC ads, they do what's called fair balance discussion. So all those words towards the end of the ad, this drug may cause this, that, and the other, and don't take it with this, that, and the other. Nobody listens to those exactly, but those describe the most common side effects from the drugs. For some people, the side effects may be bothersome. For others, the side effects may be deal breakers. So for some people, maybe having sexual side effects or gaining a little weight or having maybe dry mouth, that might be a minor annoyance. For others, it may be so significant that the person just can't tolerate that drug and we have to switch them. So for all those reasons, expecting all you need is a pill from your doctor and you're going to get well may be a little bit on the simplistic side.